Well, as always, Thursday's the time we give our medical community a little bit of time to come in and talk about the latest things going on. We have Ayers with us, an electrophysiology therapist, technologist, I should say, from New Hanover Regional Medical Center, and you've brought props. I like when you guys bring props in and talk about things. Break down your definition, electrotherapy technologist. Well, it's heart-related.
Correct.
Okay.
I work in the electrophysiology lab at New Hanover Regional Medical Center. That's where we deal with cardiac arrhythmias. Basically, anything electrical with the heart, we deal with it there.
And let's get right to the prop. What do you have there?
This is an ablation catheter. One of the ways that we treat heart arrhythmias in the EP lab is through what's known as cardiac ablation. What this does is we insert this into the heart through the femoral vein.
Okay.
Through equipment, there's X-ray, electrical signals, and a computerized mapping system. We're able to strategically place this in the heart, and the very small tip on this catheter, we can apply either radio frequency electricity energy or cold, depending on the type of catheter we have, and we ablate tissue inside the heart. Once we ablate that tissue inside the heart, it's no longer really able to conduct electricity, thus terminating the patient's electrical abnormality or their arrhythmia.
The insertion of that, in layman's terms, when that goes in, is that because of a blockage that you're trying to get rid of?
No, it's all electrical issues that we deal with.
Okay.
There's some kind of electrical short circuit in the heart causing the arrhythmia that we're dealing with, and we put this in there to terminate it.
Just kind of short circuit things.
Short circuit things.
And once that's done, our patients, does that ever come back? Does that ever correct itself, or is it once it's shut off, it's shut off?
Once it's shut off in a vast majority of the cases. There are times when it may reappear, but 90+% of the time it's gone forever.
Is this a procedure that is becoming fairly common?
It is common. We do it almost on a daily basis in my lab.
And looking at patients, I'm in my mid-40s. What age group are you starting to see that this can begin and go towards later in years?
That varies widely, and it depends on what kind of arrhythmia you have. Younger patients are typically more prone to SVT, fast rhythms. Older patients typically have problems with, once they've had a heart attack or some structural heart issue, they're prone to other types of arrhythmias. So we scan the gamut from teenagers to the elderly.
Okay. Well, if you have any questions, again, you always want to contact your physician. You don't want to contact me because they've done a lot more schooling than I have. Colin, what you got?
Temperature